issued by the chair of the Health Committee in the Council of Governors, Honorable Njuki, and the Kenya National Union of Nurses and Midwives strongly condemns the recent utterances by the said governor, who is the chairman of the Health Committee in the Council of Governors. He said that he is opposed to having the universal health coverage staff converted to permanent pension. And in his utterances, he issued certain roadblocks to the Ministry of Health, stating that he does not want them to be converted into permanent pension. We want to state as follows. One, that the none appreciate the Ministry of Health under the leadership of the Cabinet Secretary, Honorable Eden Twale, for initiating the conversion of UHC staff into permanent and pensionable. None recognizes the role of the national government and the National Assembly Health Committee for ring-fencing budgetary allocation to support this process. We also note and recognize the progress that has been so far achieved through the action of the Ministry of Health and the Parliament of this country. We thank the Parliament, both the National Assembly and the Senate, for making sure that necessary budgetary allocations are put aside to have the universal health coverage staff converted into permanent and pensionable. We therefore thank them very much for that. We also note that the Ministry of Health, together with the Council of Governors, completed verification exercise last week. And therefore, the statement by the Cabinet Secretary for Health, Honorable Eden Duale, that these staff were due for conversion from 1st of September 2017 into permanent and pensionable is welcome, is supported, and that is the correct way, and that's the legal way. The ministry has issued a clear communication, and we do not understand under what circumstance Honorable Muthomi Njuki, who is the governor for the Kanithi, is opposing the conversion of this staff into permanent and pensionable. We know that if this does not happen, we stand a risk of this money being reallocated in the next supplementary budget that will happen in the month of October. We therefore do not want to hear anything that is going to delay this process from happening from 1st of September, which is next month. We know that some of the Council of Governors have been in the forefront opposing any progress that's being made to convert UHC staff into permanent and pension. And these notorious counties are Tharaka-Nithi, Trans Nzoia, Kiambu, and Kirinyaga. Yes. We do not understand what these counties want. From where we sit, we believe that this county government are spearheading a system where they want to shortchange UHC staff and employ their relatives, employ their girlfriends, employ their boyfriends. We are not going to allow this to happen. We are vigilant, and we are supporting the Ministry of Health in weeding out the intention of the Council of Governors to shortchange these workers who have worked for more than 5 years under dubious and constitutional terms and conditions of service. We also note that these county governments have been writing show cause letters to UHC staff, sending letters to the Ministry of Health to stop their salaries. But when we go to sit on the table to negotiate, they have vehemently rejected that these officers do not belong to the county government, and they have said it is the function of the national government, and it is the national government to convert them into permanent and pensionable. The notorious counties that have been giving us this trouble are Meru, Muranga, Isiolo, Baringo, Kidui, Embu, and Tana River. We therefore don't understand what exactly the county government wants. Do they want this staff to be permanent and pensionable, or they want them to continue working under this dubious condition?